Hi there, my name is I'm a level 2 nursing student here at Conestoga, and this is my injections video. So I'm going to be telling you the steps from the beginning to the end of how to draw the appropriate medication from a vial, and as well as how to give the medication subcutaneously and intramuscularly. So the first step is to get some hand hygiene. The second step here is we're going to be looking at the MAR. So with the patient here, we have Mr. Mancini. The orders for 5,000 units of heparin subcutaneously every 12 hours. And the other orders for Haldol is 1 milligram intramuscularly every 4 hours as needed. So the first step here is we're going to be using to make sure we have the right medication present. So here I have a vial of heparin. So what we're going to be doing is we're going to be making sure this is the appropriate medication that has been ordered, is the appropriate medication that we have on hand. So the order says for heparin as a supply, 5,000 units per 1 milligram in the vial. Make sure this is accurate. 5,000 units per 1 milligram, appropriate. Make sure it's not expired. And this is an unopened vial, so all we'll have to do to clean it is just use an alcohol swab. Next, I'll grab Haldol from the machine. Again, making sure that I know that it's for the right patient on the MAR. I grabbed it from the AccuDose. Here, again, I'm going to be making sure, again, checking the MAR, making sure it's the right medication. So for Haldol, we have, for the supply, we have 4 milligrams for 2 milliliters. I'm going to make sure this is 4 milligrams per 2 milliliters, appropriate, again checking the expiration date. Next, you want to make sure that we grab the appropriate needle for the injections. So for heparin, we have a subcutaneous, and for Haldol, we have an intramuscular. For the subcutaneous, the syringe will come in a packet like this, and we're just going to make sure that it's the appropriate size and gauge for the client, based on weight, height, and other measures. So we're going to look at 25 gauge. It falls in the appropriate range for subcutaneous. Again, as we have the diameter of 0.5, which again falls with gauge, and 16 millimeters in length, which is appropriate for subcutaneous injections. Next, we're going to look at intramuscular. So for intramuscular on the syringe, we have 0.65 diameter or 23 gauge, which is appropriate for the client, as well as appropriate for intramuscular injections, and 25 millimeters in length, which again it falls in the appropriate range for intramuscular injections. So we have the right equipment there. Next, what we're going to do is we're going to grab an alcohol swab, and in preparation for injecting, we're just going to clean the tops of both vials. Disposing of the alcohol swab in the garbage. First off, I'll be doing the subcutaneous injection. Based on my calculations, I need 1 milliliter of medication to this vial. So I will drop, making sure not to put my finger on the actual plunger itself, 1 milliliter. In the case of high-level medication, you just want to have another nurse in to double check the medication. So here, I will then insert it into the heparin vial. With a non-dominant hand, raise the vial, keep my finger on the barrel itself. I will then make sure the needle is below the liquid and inject the amount of air. That would be the appropriate dose. Based on negative pressure, it should release back out to me medication. Remember, keep the needle straight, below the liquid, and draw to 1 milliliter. Awesome. I will then pull the needle straight out. I do note here there are some bubbles, so I'm just going to flick those away. Just going to give a little push with the plunger, just to release any air, and have the appropriate dosage into the syringe. Again, just making sure it's the right amount, 1 milliliter, 1 milliliter. I can then put the cap back onto the needle. I will then do the same for intramuscular. Again, just making sure that I have the right dosage, 0.5. I'm just going to be drawing up 0.5 milliliters of air. Like a dart, putting into the Haldol vial. Then injecting the air into the vial. Based on negative pressure, it will break out. Again, making sure I don't touch the inner plunger. Turn out the appropriate amount of liquid, it will then draw straight out. Flicking it to release any air. Just lightly pushing the plunger to get rid of any excess air that may be at the top of the needle. Excellent. Again, making sure I have 0.5 milliliters here, 0.5 milliliters onto the vial itself. Excellent. And put the needle back on straight. I prepare the medication for the client. I will then get rid of any garbage necessary and then move on to actually injecting the patient. Mr. Massini, I'm Alexander. I'm a level 2 nurse here at Conestoga. Can I just get your name and date of birth, please? Thank you. Awesome. I'll proceed with the procedure now. Alright, now we're going to start our injections. Because I did the dosage in the vial at the bedside, I will not be using the tape. Otherwise, if you're doing this away from the patient, you should be wrapping tape around it and writing on it the medication and the dose onto the syringe itself. So now, since I'm by the bedside now, I'm going to be drying the curtain around, use some hand hygiene, and I'll inform the patient about the procedure that I'm about to give. So here, Mr. Massini, I'm going to be doing some injections on you. I'm going to be injecting you with some heparin. Heparin is an anticoagulant, and some of the side effects include low ability to clot, as well as hemorrhaging, as well as also fever. Do you have any questions for me? Great. Alright, so for the injection for Mr. Massini, I'm just going to check the medication against one last time against the MAR. So here we're doing heparin. I'm supposed to have 1 milliliter, and I have 1 milliliter in my syringe. So I'm ready for injecting. Okay, so now I'm going to be just putting it into the proper positioning. So as you see here, I'm going to be doing it for the abdominal site. Heparin is mainly preferred to have the injections done on the abdominal site. So I'm going to just remove enough clothing and linen to expose just that site. So again, to remain privacy for the patient. So here, at the abdominal area exposed, the injection site is 1 inch away from the umbilicals on both sides, as well as from the costal margin down to the iliac crest. So it's kind of a square portion on both sides. I'm going to be asking the patient where he had the injection beforehand because I want to rotate sites. So here I'm just going to inspect and see if I see any edema, redness, or swelling. I don't see any. I'm going to palpate the area that I'm going to be injecting. Again, looking for any masses, swelling, not that I know of. So I'm just going to be applying some gloves before I inject. Alright, so I pick my area here. I'm just going to then sanitize the area with an alcohol swab. And circle area around 2 inches in diameter, circling out from inside to out. I'm going to dispose the alcohol swab. I'm going to grab my needle. I'm just going to take off the sheath. And I want to pinch the skin here. I just want to see that the needle length is around half the size of the pinch, just to make sure to see proper length. It's not going to go too deep or too interficial. So if here for the picture of this patient's fine. I'm going to move it outwards. I'm going to be using this as my demonstration. So in the case of an obese patient, what you want to do is you want to keep it pinched and inject it 90 degrees straight in for subcutaneous. For cases where they don't have a lot of muscle mass or they're pretty frail, you want to do it at a 45-degree angle. For this procedure, I'll be doing it 90 degrees as it's pinched, so for an obese patient. So I'm going to quickly inject it in. And release over several seconds. I'll pull the skin taut, release quickly. And then put some gauze pad right on top. So in the case of heparin, what we want to do after we inject it is we just want to keep hold for 30 to 60 seconds after. I'll then put the sheath back onto the needle, dispose into a puncture-proof container. And then again for this injection, I'm going to be remaining with Mr. Mancini for around 7 minutes after, just to see if there's any allergic reaction, as I'm going to be documenting the information as well into the MAR. Then return around 30 minutes after to see how the injection went, see again if there's any adverse things going on there. But yeah, that concludes injections. Alright, so now we're going to be injecting the medication to the patient. First off, what I'm going to do is I'm going to draw the curtain to ensure privacy. I'm going to introduce myself to the patient. and I'm then going to inform him about the medication. So here we're going to be doing intramuscular injection of Haldol. Haldol is an antipsychotic, and it can produce side effects such as nausea, vomiting, urine retention, and other such symptoms. I'm just going to inform Mr. Mancini he does have the right to refuse medication if he's not certain for it, but I will ensure that this is the best medication for him at this certain time. So what I'm going to do is I'm going to inspect the site. I'm going to get him in the right position first off. So because I am right-handed, I want him to roll into his left side. So this would be how he's sitting right now. I will then use my hand, and I'm just going to palpate the area, noting any tenderness, any redness, making sure that there's no masses that I can puncture into. So I see that it's fine. I'm going to be applying some proper gloves before I move any further. Right. So how I'm going to locate the proper site is I'm going to lay my hand perpendicular to the femur, my finger to the anterior iliac crest, into the anterior iliac spine, and my middle finger almost parallel with the femur, and my thumb to the groin. So here I have a little V area. I'm then going to mark this with an alcohol swab. And that's where I'm going to be injecting the actual needle into. So for demonstration purposes, this is going to be my patient then. So we'll then open an alcohol swab. I will clean the area, starting from the center, and moving outwards to around 2 inches. And then disposing of the alcohol swab. I will grab my medication, making sure again it's the right medication that I have drawn. Checking with the MAR one last time. So yeah, 0.5 milliliters of Haldol, perfect. I will then take off the cap. I will then put my hand onto the patient, and using Z tracking method, I'm going to pull the skin around 2.5 centimeters to the side, injecting straight into it. I will then aspirate. If I should see blood, I know I'm in the wrong area. I don't see any blood, so I can continue on with the injection. I'll inject the medication into the patient for a period of 5 milliliters over 10 seconds, or 10 milliliters over 10 seconds. Let's slowly bring it out. Awesome. Bring back the Z tracking, put the cap on back onto the needle, and dispose the needle into a non-puncture proof container. And dispose of my gloves, making sure that I put gauze over the patient. I will then stay with Mr. Mancini for around 7 minutes after, just to see if there's any allergic reaction. I will then document my findings into the MAR, and then come back at a period of maybe 15 to 30 minutes after injection, again to see if there's any allergic reaction to the medication.